Welcome, everybody. I would like to open this meeting of the DEIC at 5:02. First business is to do our roll call.
Committee Member Beatty,
Here.
Committee Member Anderly,
Here.
Committee Member Andrews,
Here.
Committee Member Rochto,
Here.
Committee Member Stout,
Here.
and then Committee Member Abels is absent. And we have Council Liaison Prokop virtually with us.
Welcome,
Yeah.
everybody. All right, we need to
It's that time of day, isn't it?
yes, my
We need
brain.
to have a meeting.
We need to what is the word I'm thinking of? Approve, that's it. Yes, the minutes. So we need a
Mads, are you keeping the minutes?
Yeah.
Very well done. Thank you.
thank you, yeah.
Looks good. I'll motion to approve the minutes.
I'll second.
Excellent. All in favor?
Aye.
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 Passed. Thank you. So for our business before, we have Clackamas County Drug Prevention here. April's with us and she's waiting patiently to present. Before we get to that, Elena, in the city of Estacada is putting together a newsletter for, I believe, isn't it January, February? I think those are the months.
I believe so, yeah.
Okay. And so I just put together something here for those of you that have seen the agenda. And if you guys want any of that changed, now would be the time to talk about that. Does everybody have it in front of them?
I do not.
It's on the first page of the business under newsletter content.
Oh, okay.
That would just be a little blip under the DEIC. They're just looking for like each committee to kind of have a little blurb of what they've been doing and what they're going to be doing and that kind of stuff. And she didn't want a lot of information, so I just chose to talk about what we're doing tonight
good.
and what we're going to be doing.
Yeah, and that
Thank
was
you.
also overlapping with the report that was submitted from the committee to the city council for the last meeting. So that is totally
Perfect.
parallel with what we've already reported.
Great. Okay, so I guess I need to have a motion in a second.
And that is just to include that into the agenda for January, February, or?
No, this would be going into the newsletter,
Oh,
the city newsletter.
Sorry.
Yeah, so I just needed your guys's, yeah, this looks good, or no, let's tweak it, or no, we don't like it.
It looks good. You did a good job.
So do we want to do a motion to approve the newsletter content for the January, February? Is that
That's what I'm looking
round
for.
enough?
Yeah, unless you guys want to change
Second.
anything.
I'm fine with it.
Okay, and all those in favor?
Aye,
Aye.
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 super official.
All right. Thank you, thank you. And so April, we're going to hand it over to you and Matt's is going to get you a microphone. Thank you for presenting tonight.
Yeah, thanks for coming out, April.
And while Mads is doing that, I can just introduce myself. I'm April Heron with Clackamas County Public Health Division, and I lead our substance use and overdose prevention work there. And I've been doing that since about 2016 when I was asked to start working on something called the opioid crisis. And I said, what's an opioid? Because my previous history in public health had really been more around vaccines and infectious disease and chronic disease. So it was a brand new world to me, but I hit the ground running, and it's been the favorite thing I've done in my public health career. It's very challenging. It keeps me on my toes, and there's never a dull moment. And I've gotten to work with a lot of different community partners in this work, which is probably why it has been just my favorite topic to tackle in the public health world. But just about any discipline these days is dealing with our opioid and drug crisis, everyone from healthcare to law enforcement to schools and businesses, which I think, Tammy, you mentioned in one of your emails. So I'm really happy to be here tonight to provide a little bit of information on what we're seeing, some response efforts, and then we'll dive into a naloxone training. So yeah, Mads, if you want to go to the next slide, I think I just sort of summed that up. That's what we'll spend our time doing this evening. And I can either take questions along the way, or we can save them until the very end. Whatever works better for all of you, you just let me know.
Okay.
It is a lot of information.
And Mads, is the microphone close enough to her? Is she being heard really well?
I can hear it.
That's better.
Yeah.
Okay.
Good.
Yeah.
Okay, perfect.
And if I need to talk louder, I will bring out my
No,
loud
that
voice.
fixed it. That fixed it.
That's good. That's better.
Alrighty, so if we want to go to the next slide, I do have about 5 or 6 slides on data, so don't fall asleep on me. And again, if you have questions along the way, I'm happy to take them as we go. So looking at sort of this big picture overview of what we've been seeing nationally as the opioid crisis has unfolded, you'll see the blue line there. That represents prescription opioids, and we see that line really started to go up in the early 2000s, and then it has since leveled off. The other thing I want to point out, because that was what we consider the first phase of the opioid crisis, we then went into what would be considered the second phase, which was primarily deaths due to heroin. And that's that darker blue line that you see start to go up around 2013, and then it kind of goes down again. The more significant change of what we've seen is that gray line there that you see significantly going up around 2015. That line is deaths due to fentanyl. So as the deaths from fentanyl have gone up, you'll see that deaths from prescription opioids and heroin really started to go down. And that's where we saw what we would consider the third wave of the opioid crisis, which was primarily fentanyl. And right now we're in what we would call a fourth phase, which is fentanyl mixed with another drug. So it's really polysubstance use at this time. What I want to point out here on this slide is the deaths from drug-involved deaths hit an all-time high in 2021. So right there, kind of in the middle of the COVID pandemic. And those deaths were from both illicit drugs and from prescription opioids. That was a 51% increase from 2019. So significant changes were seen in the US during that time. And then a 16% increase from 2020. Deaths from synthetic opioids, primarily fentanyl, made up about 70,000 of those deaths, or 66%. That just kind of puts it in, if you think of a pie chart, fentanyl was 66% of that. Those from methamphetamine also made up a significant portion, over 32,000. Which is about 30% of the total deaths. And if we're looking at this line chart here, that would be the yellow line that you see also increasing since about 2015, 2016. And then we've also been keeping our eye on cocaine, which primarily has been a drug more predominant on the East Coast, but it's making its way to the West Coast again. And that would be the orange line. And then I mentioned, as those have all gone up, we have seen a leveling off or a decrease in both prescription opioids and heroin. And next slide. So just sort of level setting to talk a little bit about what fentanyl is. It is an opioid. And what we're talking about is illicitly manufactured fentanyl. There is also a prescription fentanyl patch, but that's not really what we're talking about today. Fentanyl works like other opioids where it binds to the opioid receptors in the brain, which control pain and emotions, and they give feelings of euphoria. And they're very, very addictive. So fentanyl is about 50 to 100 times more potent than morphine.
Wow. Oh, wow.
And when we're talking about illicit fentanyl, we're talking about a substance that is made primarily in home labs. So many of the ingredients are coming across the border, and then they're either manufactured across the border and coming across, or certain ingredients are coming across and they're manufactured here in home labs. So nothing fancy, people who really don't know what they're doing. And they're mixing fentanyl into other drugs, like oxycodone pills, heroin, methamphetamine, just about anything. And it's a very cheap drug to make. So it's cut into these other drugs, and it's a very cheap but addictive option for people. We'll go to the next slide. So in the earlier days of the opioid crisis, many people were exposed to fentanyl without them actually knowing that was in the drug that they were taking. But now that we're well into the crisis, it's actually what people are seeking out. The demand for heroin has pretty much gone away completely, and people are specifically seeking out fentanyl or fentanyl with another drug. When people overdose on fentanyl, it binds to those same receptors that control your respiratory system. So that's how people end up overdosing and dying, is it either slows down or completely stops their breathing. And the pictures here at the bottom just show you how little of a dose of fentanyl can be fatal. So in the picture on the left, just a few grains of what look like sand or salt. That's the lethal amount compared to a lethal amount of heroin. And then on the right, I believe that's about 2 milligrams of fentanyl next to the penny is what could be considered lethal. And next slide. So here we're looking at more recent data. I do want to point out the map's cutting off the date just a little bit, but this is data from May 2023 to May 2024. It comes from the CDC. It is predicted overdose deaths, meaning that we think that these are deaths due to a drug overdose, but the toxicology reports are still being processed. But I'm thankful for this data because although it's not final, it really gives us a good idea of what we're looking at nationally, but also here in Oregon. So what we see is that as a country during that 1 year time frame, we saw a 12.7% decrease in drug-related deaths. So that's a great thing. However, some states are still seeing increases. So the orange states are the ones that I'm talking about. And you can see that Oregon is unfortunately one of the states still seeing an increase from opioids and other drugs. From the May 2023 to 2024 timeline, we saw a 21.84% increase. We rank second in percent growth from drug overdose deaths. We're just behind Alaska, who ranks number 1. And one thing I also want to say is this isn't necessarily, we don't have the highest number of overdose deaths. We're just one of the states that saw one of the highest percent increases during that time frame. And one thing that we know about drug trends is oftentimes they will sweep the US from East Coast to West Coast. So while we don't exactly know, but we do have some theories that the East Coast has just seen decreases much earlier than the West Coast. So fingers crossed, we'll start to see some of these same changes over the next year or two, because we were about a year or two behind the East Coast and seeing the significant impacts from fentanyl. And then on the right, this is some data that comes from the National Survey on Drug Use and Health. It's a self-report study that's done every couple of years. The last one that was done in 2021 shows that Oregon ranks second in the country for self-reported substance use disorders. That could include alcohol, opioid, any type of substance use. We also rank first in prescription opioid misuse and first in methamphetamine use. And next slide. So now we're gonna shift to looking at more local data. This is Clackamas County. We, out of public health, do track drug-induced fatalities. We keep our eye on both fatalities and non-fatal drug overdoses. So as you can see, the trend over time, we're very similar to Oregon and national data, where we have continued to increase. From 2022 to 2023, that was a 23% increase. Again, I just want to point out the 2023 numbers are not yet final, but last we were showing 119 county residents had died from a drug-induced cause. A little bit of good news. I mentioned that we've seen some leveling off across the country. And for 2024, when we look at our county data, we're seeing a very similar trend so far. When we look and compare to where we were at this time last year, we're well below 2023 numbers in terms of fatalities, also below 2022 data. So we're really hoping that there's something to the shifts that we were seeing nationally, and that we'll start to see some of that locally. And next slide. So whenever I'm presenting to a local group, I like to present some of the data that we are collecting that shows zip code and city level data. So here we're looking at the areas of Clackamas County most impacted by drug-related deaths. So when we're looking at the death rate by zip code, we see Gladstone, Eagle Creek, and Estacada. Those are the dark blue areas, tend to be the hardest hit. But then when we look at the areas with the highest raw number of deaths, those are the ones outlined in the red, and those would be Oregon City, Happy Valley, and Milwaukee. So I just wanted to sort of showcase it's really the urban areas when we're looking at raw number, but when we shift that and look at it a little bit differently by rate, we see a very different picture. So we are very much taking that lens when we look at how we're responding to the crisis in Clackamas County. And next slide. One slide I want to just take a little bit of time to talk about are the circumstances of unintentional drug overdose deaths. And this information is pulled from an annual legislative report that Oregon Health Authority puts together every year. And this looks at overdose deaths in Oregon. And these were some of the key findings that were noted in the 2022 report. And a lot of these findings are really helpful for me and my colleagues in the work that we're doing. So they found in the last report that many people who had died of an overdose had never touched the healthcare system. About 78% of people who died at that time were not receiving treatment for either mental health or substance use issues at that time. So this really tells us that we need to be a little bit more creative in where we're interacting with folks at different access points in the community and attempting to link them to help and resources. We can't just focus on the healthcare system. Many people who overdosed were not administered naloxone. That was 71% reported across the state. I do want to say I think we're doing a lot better of a job here in Clackamas County, thanks to a lot of the funding we've gotten to purchase naloxone and get it out across the county to lots of different folks and do lots of training. So if we looked at that number at the county level, I think it'd be a lot lower. Some of the root causes that were found were lack of a connection to community, co-occurring mental health issues, and just absence of basic needs. Oftentimes, it's really hard for people to be successful in their road to recovery or to even think about seeking help if their basic needs aren't met. So 36% of people who died of an overdose had a diagnosed mental health illness. That was just the people who we knew had a diagnosis. There's likely many more beyond that. And then just under 20% were noted to be houseless at the time of the overdose. And don't know if that number seems high or low to you, but when it's known, that is something that is being tracked in the data. There continues to be a lot of stigma associated with substance use, which often prevents people from seeking help in the beginning. There is a big lack of access to shelters, detox facilities, and treatment centers. I will say, though, we are making significant progress along these lines in the county, thanks to a few things. Measure 110 funding really did invest in a lot of great resources. We do now have a detox facility. It's on the border of Clackamas and Multnomah, but they very much consider themselves to be Clackamas County facing. So that's great. We have a recovery campus that the land has been purchased, and in a couple years, we'll begin to see full-scale detox treatment recovery services available in the county. And then we've got a really fantastic navigation center coming into Oregon City, and that'll primarily focus on houseless mental health and substance use. So some really nice things that have come our way. However, many people don't know still what community resources exist, and there are resources that exist. And so that is one thing that we've got to be better about, is linking people to those things and making sure that they know where to go when they're ready to access help. And next slide. Okay, so just very high level from the public health division side, this is how we're approaching the addiction crisis in the county. There's sort of 4 big buckets. Prevention, that includes decreasing harms and death from drugs, and that could include overdose prevention, messaging, naloxone distribution, safer prescribing of opioids. All of those things are prevention. The data and surveillance, I showed you just that barely scratches the surface on actually what we are tracking. We have a lot of data that goes into the weeds so that we're making sure that we're serving the populations and areas of the county that need it most. Linking people to treatment and recovery resources. And we do that quite a bit in partnership with community-based organizations, first responders, cities, you name it, we want to partner with you. We really want to de-silo the approach. It's not a crisis that's just for one entity to solve on their own. It's kind of an all of us problem. And so we're all about the partnerships. And next slide. Okay, so now we are going to completely shift gears and move into more of the naloxone training portion of the presentation. I want to go to the next slide. So this part of the training is going to cover what naloxone is. We'll go through a little bit of interactive myths and facts about naloxone, cover a couple of laws that are important to know about, risk factors for an overdose, signs of an overdose, and then how to respond. Okay, so what is naloxone? I brought several boxes with me tonight to give to you after the presentation, but it is a medication that can reverse the effects of an opioid overdose. So I mentioned that an opioid like fentanyl or heroin or prescription opioid binds to the opioid receptors that can start to really suppress our breathing. And what Narcan or naloxone does, naloxone is the generic name, Narcan is the nasal formulation. So I use those two names interchangeably, but what Narcan does is it comes along and it knocks the opioid off of that receptor and it restores breathing again. And we can go to the next slide. Okay, so I have a couple of myths and facts here this is where you might have to, do several buttons to click add. So if you want to click one more, myth or fact. Naloxone encourages drug use and discourages people who use drugs from seeking treatment.
Myth. Is that a myth?
Correct. Yes, it's a myth. So death actually keeps people from seeking treatment. So by reversing an overdose, we give a person a second chance to correct their path, seek help, whatever that looks like for them. And the next one, naloxone is another drug that can be abused. Myth or fact?
Yeah.
Correct. Naloxone is safe. There is nothing that is addictive about it, and it cannot be abused.
Good.
And next slide. Okay, so overdoses are more likely to happen for longtime drug users. Is this myth or fact? Correct. Looking at the medical examiner data we have, most often than not, overdoses are happening in people with about a 5 to 10 years or longer history of drug use. And naloxone can be given by the person who is overdosing.
Myth.
That is a myth. Right. Somebody who's overdosing cannot administer it to themselves. It's like a nasal spray. So that's why it's important to get others in the person's circle, family or friends, or in the community trained to be able to respond and help folks. Okay. Naloxone will not work if the person overdosed on something other than an opioid. Yeah, that's a fact. If you just think of that slide I showed you with Narcan is just very specific to the opioid receptor. However, it's good to always give it because we really don't know what a person took, and more often than not, it's a very good chances fentanyl is going to be in whatever the person took. So at least we can get the person breathing again if that's the issue. And of course, we always want to call 911 first. But if there is something else in the person's system that still could lead to the person, maybe not waking up, not completely breathing again. So that's why we want to have EMS on the way. And the next one is naloxone is difficult to access. That's a myth. Thanks to some changes in how naloxone is being made available. It's now over the counter, so it's at just about any pharmacy. It is a little spendy. It's about $38 or more for one of these boxes, which includes 2 doses. So there are other ways you can get it. Insurance will cover if it's for the person who wants the Narcan. There are 3 Narcan vending machines in Clackamas County. They're actually all in Oregon City right now, but we're always happy to expand to make, options available in rural communities. So happy to talk more about that, what that might look like out here in Estacada.
Can I ask where those are currently located, just for out of curiosity?
Sure. Yeah. The vending machines were actually purchased by our sheriff's office. So there's one in the jail lobby. There's one at parole and probation down in downtown Oregon City, and then one at the transition center.
Okay.
Yeah. And then it's a partnership effort. So they purchase the vending machines and then we stock them with the Narcan.
Gotcha.
And I think there might be one more if we want to go on. Yep. You cannot overdose on fentanyl by touching it. Myth or fact? That is a fact. Fentanyl actually does not absorb well through just routine skin contact. The only exception would be if you were to you have used hand sanitizer, which is alcohol based, then it could be a little bit more absorbed into the skin. But as of now, there are no clinically confirmed cases where somebody overdosed on fentanyl just by touching it or breathing it in. And then basic PPE is enough to keep first responders or any responder safe. Yep, and that is true. just basic gloves, N95s or the surgical mask, CPR face shields, those are all fine. And then if you were to come into contact with it, just of course, wash your hands with soap and water.
I have a quick question.
Sure.
So on shows, like when you're watching shows, right? Is it, so maybe it's not fentanyl that's like in the show that they're worried about touching. Is it meth? What is it that gets in the air that? So it's just a Hollywood
Is
thing.
that what's
Okay.
happening is there's a bunch of sort of pop culture
Misinformation.
taboos that are being, or not, but
Mm-hmm.
just the, like you're saying, myth and fact, like, well, or I've heard of like people talking about stolen cars being totaled because the upholstery is contaminated with fentanyl. Is that also sort of a false?
That
representation.
could very likely be true. I just sort of think of it like any exposure to any, if you were to just inhale any amount of any drug, right, is not good for you. And
Right.
you may physiologically react to that. You might not feel good. You might get a headache. You might feel nauseous. I think about it in the same way. It's not, you're not overdosing
Mhm.
from the breathing it in or touching it, but you may not feel good. But I think people get those two things confused.
Right.
Okay,
Yeah.
that's what I was.
Yeah, an overdose would be, it would suppress your breathing to the point of you cannot breathe on your own. And, you know, passing out is different than not being able to breathe on your own.
Right.
So that's the difference there.
Okay.
Okay, so a couple of laws that I wanted to cover, the Good Samaritan law you may have heard of is protects anyone who administers naloxone if they're acting in good faith to respond to someone who they believe has had an overdose. So that will cover you if, you know, you were to use Narcan on someone, whether they had overdosed or not, you are covered under the Good Samaritan law. And then in 2023, House Bill 2395 passed, which puts protections in place for any type of public business, school, public building that wants to have Narcan there and make it available to the public to access. So if you wanted to have a nalox box here at City Hall, which is just like, think of a really small vending machine with maybe 3 or 4 boxes of these, and people could come in and take them, you're protected from any kind of liability that could come about from that. Yeah. And okay, so now we're going to move into talking about risk factors for an overdose. So the first one is mixing an opioid with any other kind of drug or alcohol is never a good thing. It's going to only enhance a person's respiratory system for shutting down, especially an opioid with alcohol or an opioid with a benzodiazepine, which is an anti-anxiety pill like Xanax. Those two things are really bad combinations. Reduced tolerance. So when someone's using the same drug over and over, their body builds up a tolerance. But when they stop using that drug, so if they go into jail or into treatment or the hospital, and then their body becomes used to not having that drug every day, that's going to affect someone's tolerance. So very oftentimes, this is exactly why we're seeing so many overdoses for people who are in and out of the justice system, because they're in jail for a week or two. They're not using any drugs during that time, and then they get out, and I think their chances of overdose are like 10 to 15 times higher. So that is one of the reasons why we have the vending machines where we do, is for this very reason. Another risk factor is changes in supply. The drug supply is changing all the time. We've actually just within the last few months have moved into a period of the fentanyl reportedly being very weak. We're hearing that there's an industrial chemical that's being laced into the fentanyl supply. This acting as a filler, so there's less and less fentanyl in the drug supply. And we're going to see some impacts from this when it goes back, because now people's tolerance is down again because the fentanyl they're using is in a very low amount. So right now we're in a time of just working with our harm reduction partners to get messaging out about this very thing, just to be aware, because when the supply changes again, and it will, that's when we tend to see overdoses spike and increase. And then not being able to decide your dosage. So where we've really seen this is with the pressed pills, with the home labs that are making knockoff opioid prescription pills. They're lacing fentanyl into those pills. So people think that they're buying one thing online or on the streets. They might think that it's a Xanax or an oxycodone. But what it really is fentanyl. And then if you also think of it like, we call it the chocolate chip cookie effect, where one pill could be almost completely all fentanyl, and then the next pill could have just a couple little spots of fentanyl. People really don't know what they're getting. It's like playing Russian roulette. So there's a lot of messaging around this too. And we tell people, you know, we use a lot of harm reduction messaging. We're always here to link people to treatment and resources, but we want people to be as safe as possible if they are going to make the choice to use drugs, and it's about keeping people alive. So these are a lot of the messages that we're using with residents in the county. And then, of course, not using alone, that's not necessarily a risk factor for overdose, but it certainly is going to increases your chances of dying if you're using something alone. And you get that one pill that is all the chocolate chips, then, you know, your chances of making it if you're alone really aren't very high. Sure.
Does the county help get access to testing strips?
We do, yes. So House Bill 2395, which I mentioned, there were several components under that bill. And one of those components also made certain things like fentanyl test strips, which were considered drug paraphernalia and were illegal. It made those legal. So now we are able to distribute those, not in large quantities. We don't do a lot of that out of the public health side, but we do have some. They are requested by treatment providers, by health clinics who want to get them out to patients that they know need them, but primarily they're given out by our harm reduction partners.
And then just for my own understanding, your harm reduction partners are essentially liaisons between the county's effort and then people that are being affected. Is that sort of how I understand that?
Correct. We contract with Outside In. They are the only harm reduction partner in our county.
Okay.
Yeah, and they are at two different locations. One of them is the Clackamas Service Center, and one of them is the Father's Heart, which is located in Oregon City.
Do they still have that location in downtown Portland?
They do.
By the freeway?
Mhm.
Okay.
Yes, they do. All right, so if we want to move to the next slide, we're going to talk about how to recognize an overdose. So one thing to note is an overdose may not happen right away. It could happen over an extended amount of time. It really just depends on how the person is using drugs, whether they're injecting them versus smoking them or swallowing them, and then how their body metabolizes them. So that's just one thing that we like to point out. And then signs of an overdose are blue lips and nails, just from the lack of oxygen being distributed throughout the body. You can't wake the person up. And then their breathing is going to be very slow, shallow, or sort of a gurgling sound with their breathing. And we always like to tell people, if you're going to respond to an overdose, make sure that you put your safety first and that it's a completely safe scene to put yourself into, or if it's one that you should just call 911 and let them take it from there. Okay, so how to respond to an overdose. So we're going to walk through the steps here. If you see someone lying there and they appear to be unconscious, they could be having an overdose, especially if you may see paraphernalia or other things that would lead you to believe that it's an overdose. You'll want to try to wake them up. You're going to check for breathing. So basic first aid, look, listen, and feel. If they don't wake up, there's a couple things you can try. You can say, I'm going to use Narcan on you. That in itself might get someone to kind of start to wake up a little bit because people generally don't want to have Narcan used on them. The other thing would be the sternum rub. So if you were to take your knuckles and rub it up against someone's sternum, it's a very uncomfortable feeling, and that could also wake someone up out of a very deep sleep. If they still don't wake up, the next thing you're going to want to do is call 911 and put it on speakerphone for a few different reasons. This will help you to really be able to multitask. You're going to want to keep an eye on the timer. And then you can also be talking to the 911 operator while you're administering naloxone and telling them what's going on. So to administer naloxone, I don't have a single dose to show you, but it does look just like a nasal spray. So you're going to take one of those out, put it into the person's nostril, and just push the plunger up and kind of keep their head tilted back so that it doesn't run out. And from there, that's when you're going to want to start timing for about 2 minutes. So you'll be looking at your phone because you will want to wait and administer a second dose of Narcan once 2 minutes has gone by if the person's not breathing on their own yet. Okay, so next slide. So during this 2 minutes, if you feel comfortable, you can provide rescue breathing. So you'd want to just check the person's airway, tilt their head back, pinch the nose, and one short breath every 5 seconds. I did bring some of the CPR face shields with me today, so we do hand those out whenever possible. The rescue breathing is really important because, of course, as time goes on, it's lack of oxygen getting to the person's brain. But if there is another drug involved, we really want to be able to try to breathe for the person until EMS gets there, if at all possible. So after you've been watching your phone and 2 minutes goes by, that's where you could give another dose of naloxone if the person's not breathing on their own and if EMS hasn't arrived yet. One thing I want to say is the goal is not for the person to completely wake up or stand up. We just want to get them breathing on their own. Their eyes might still be closed, but if you can see, you know, their chest rising and falling, you can tell that they're breathing, mission accomplished. And hopefully it won't be long.
I have a question. For parents and loved ones, what does the paraphernalia look like if it's not pills?
It could be different things. It could be needles. It could be a bottle of prescription opioid pills. It's really just anything that may, you know, lead you to believe that the person's been taking something that could have, you know, led them to unconscious or stop breathing.
Tinfoil,
Yeah.
straws.
I think the microphone is out, you guys.
I know that some of them actually take that fentanyl patch and put it in warm water and try to get the fentanyl out of it that way. And then
That's what I was
double check that.
wondering.
Heidi Mads is changing the batteries on the mic.
Thank you.
Parents thought something laying around or a loved one.
Like I mentioned, there could be nothing on scene because if the person took something
Mhm.
and then the overdose happened 2 or 3 hours later, there may be nothing.
Okay.
But administering Narcan is never going to hurt anybody. If that was not the actual case, it's not going to hurt anyone. So better to administer it than to not. EMS does that quite often, actually. Okay.
Thank you, Mads.
So if you need to administer a second dose, that's great, do that. We get a lot of questions about how many doses of Narcan are actually needed to reverse an overdose. And it's very rare that they would need more than 2 doses. We consult with our partners at Clackamas Fire District on this all the time. They're the ones out there responding to, by and large, 80% probably 80% of the overdoses in the county, and that comes straight from them. That very rarely does it take more than 2 doses of Narcan. I also want to say that each time we give someone more doses beyond that, it puts someone more and more into a withdrawal when they do wake up, and they just tend to feel more and more awful. So it's not really a resource that is good to use more of, because more isn't going to necessarily make somebody wake up. It's expensive, and it's going to make the person feel even more awful. So after that, once the person's breathing, we will want to put them into what we call recovery position. So it's almost just like they're sleeping on their side. You would roll them over and put their arm and their leg out to prevent them from rolling over. And this is really in case they were to vomit, then it wouldn't aspirate and they wouldn't choke on that. And so by putting their hand under their mouth, that sort of helps to keep their mouth open as well. And then if we go to the next slide, when they wake up, you can tell them what's happened. They're probably going to be confused. They might be upset because they had just spent money on something and, you know, they were overdosing, and sometimes people don't like to be Narcan. They don't feel great when they come out of it. But the good news is that the symptoms do wear off. Symptoms might include headache, nausea, vomiting. But this is where you can hand it off to EMS once they've arrived, and they'll be able to assess the situation, transport the person to the hospital if they're willing to go. But it is good just to explain to them what happened. And then the next slide, of course, encourage them not to take more drugs, because that's what somebody may automatically want to go out and do. Naloxone does wear off after about 30 to 90 minutes. And if there's enough drug in their system, that will take over on that opioid receptor again. And that's where somebody will start to feel okay again if there's enough drugs in their system. So that's why they should not go take more, because that could just really put them into an overdose again once that naloxone wears off. And we do say it's important for someone to stay with them at least until EMS arrives for those reasons. Okay, so now we're going to just walk through the steps together. Let's see if we can remember what is the first step. Okay, so we see them lying there. What do we want to try to do?
Wake them up by the talking to them or
For this.
Yes. Okay. So if you want to go to that one. Okay. And then what is the next one after that if they don't wake up?
Administer.
call 911.
Call 911. Yes. You want to make sure they're on the way while you do your part of the response. So what would you do while you have 911 on the speaker? What's the next thing you're going to do?
Tell them that you're going to administer.
Well, at this
Narcan?
point, they're not waking up, and we have probably tried the sternum rub or shaking them. So now we're going to actually administer the
Narcan.
naloxone. Yes. Okay.
And you're gonna time.
We're going to time it. And then if you feel comfortable, what are you going to do during those 2 minutes?
Rescue
breath.
breathing.
Yep. Rescue breathing. Okay. So let's say 2 minutes goes by, or you waited as long as you can, because it might just seem like an eternity, and what's the next thing you're going to do if they haven't woken up yet?
Second dose.
Second dose. Yes.
And then put them on their side.
Yep. And then roll them on their side, and you'll just stay with them until EMS gets there. Yes. Great job, everybody.
So do you have this piece in like a flyer or something that when we give these to businesses,
Mhm.
they'll know the steps so that, I mean, we can go over them with them, but
Yes. So there's a couple things. We do have a piece of paper. I mean, I can even just give you this slide right here. But there are steps on the box too.
okay,
Yeah.
okay.
Small
The
text
writing's
above the door.
pretty small, but it's, it's the basic steps that I just reviewed with all of you. So it's right there on the box.
Okay.
And then the link to a really great training video that we have is also on this slide.
Okay.
And then if you want to go to the next slide, I think, I wanted to point out, we have a couple options coming up. Because I know that there's going to be some outreach to businesses, right? Okay, so I have a few things for you. So we have the flyer that you see up there. We have a couple of naloxone trainings coming up. We do quarterly naloxone trainings, very similar to what I just did with you, but there's a few more people involved. The next one is going to be on Zoom on November 21st, and then an in-person training in February of next year.
Okay.
So I brought some flyers for that. So as you're out and about, you can give those to folks as an option.
Good.
And then again, there's the link to, it's like a 6-minute training video. It's really, really great. If you ever forget or want to review, that's our favorite one. And then another thing I brought is we actually have a naloxone work group in the county, and we did some business outreach about a year ago, and we made up a flyer to give to businesses, and it talks about increase in overdoses, what naloxone is, and why it's important for them as a business to have it in their first aid kit. So I brought some of those for you too, because I know, Tammy, you had asked for, maybe some talking points as you're going around to businesses. So I think this will be
Good.
exactly what you need.
Okay, perfect.
Yeah, between the two
Thank you.
flyers. And I think that's it. Yeah, unless you have any other questions for me.
More just like feedback. Obviously, we're trying to strategize the best way of approaching this. I mean, clearly it's an issue.
Yeah.
It seems like everywhere. That doesn't mean that it's not sort of a little taboo, or
Right.
people are resistant to sort of embracing the preparedness to being proactive about how this works. I'm just thinking about what you brought with you to share with us, and what are there like certain areas or locations like that you think are more beneficial to have it than others? Is it more of like a, I can tell you there's like pockets around town where people that are unhoused, feel more comfortable being.
Yes.
So should we sort of focus on businesses in those areas? I mean, I guess, do you have any sort of peripheral recommendations?
Yeah, I think that's a great starting point. And I would actually say you might be very pleasantly surprised. You might have some folks who are very resistant, but based on our outreach last year, we primarily focused on apartment complexes and areas that we were seeing higher rates. And just about everybody we visited was like, thank you. Yes, I'd love some. And the requests that we're getting for naloxone, we probably get 3 or 4 requests a week. And we've seen a huge increase in just across the board businesses, churches, community groups, like all sorts of people reaching out and asking, automotive businesses. Like, it's really been surprising to us, just the different groups that are reaching out, wanting to have it on hand. So I don't know if you have like a chamber out here, but maybe just promoting it
Yeah.
there. Yeah, chamber. And I'm happy to do a deeper dive with the data to see if there are certain things, certain pockets. I don't know if there's any areas of housing, like apartment complexes. I mentioned that's been a big one in Milwaukee and Oregon City. Just to make sure that apartment managers have it on hand, or if people that live in the community know where to find it if they want it.
Mhm.
We do have those little Nalox boxes I mentioned. They hold about maybe 3 of these kits. If there's an area of Estacada that you would want to host one of those or 2 of them, we could think about that.
And I'm assuming too that this is sort of standard issue for schools within their sort of nursing departments. I mean,
Yeah.
the stories that that I've been personally affected by are a friend of mine lost his son at school. And
Oh,
Wow.
it was like a couple weeks ago, another family
Oh.
in town lost their dad. He was at work when he overdosed.
Wow.
So
Yeah.
it's very much so an issue.
Doesn't have to be a drug user who's taken too many drugs. It could be
Right.
accidental, easily accidental.
Oh, yeah, it could be prescription, it could be illicit, it could be mixing a prescription with something else. I mean, across the board, it doesn't, addiction isn't, it doesn't play favorites, it affects everybody, every family. I've talked to countless parents who have lost a child. So I think this is why people are a little more willing to embrace it, because so many more people have been touched by the crisis in some way that it's changing the way people think about it.
Yeah, I
Yeah.
mean, that's, exemplified by
Definitely.
the metrics that you were showing initially. It's like, that's stunning to see,
Mm-hmm. It is.
Yeah.
So is there any data for Estacada? Like, I mean, does the county have like data on deaths in different cities within it?
Well, in that map that you showed earlier was per capita, sort of, like, we have a very high rate per capita.
Right.
But lower numbers than highly
Right.
populated
Exactly.
areas.
Okay.
Yeah, what I could do is do a little bit of a deeper dive to look at areas of Estacada that maybe are seeing more, but my guess is it might be kind of widespread, which is why it might be a good idea just to share it with the chamber. Even if any of you know business owners personally, just start to spread the word that it's available as a resource for first aid kits. And, of course, encourage them, they can come to a training and just learn more before if they want to decide what they want to do. But yeah, apartment complexes, that might be another good one.
And I envisioned us going to like as many businesses as we can,
Yeah.
like in the heart of Estacada, because people go out to eat.
Yep.
Right? They're going to the drugstore, they're going to the gas stations, they're going to Harvest Market, all these places. And if they don't have any,
Right.
that's why I thought the decals were so great, because we had thought about that actually of, hey, we could have a decal, and I think
Right.
that was Denise's idea. So they have those decals.
Yes, I
So,
did bring some of those too.
yeah,
Mhm.
so that's why I'm resistant to just give it to the chamber, because I feel like, number one, it gets us into the businesses and we can say, hey, we're a part of this committee.
Right.
This is what we're really wanting you to learn about this and why, we
Good.
saw the map, we see how many people, and if you get us more data even,
Yeah.
we would have
I-
more, like we've had, I don't know, we've had 30 deaths this year in Estacada and Eagle Creek or whatever, like, yeah, if we could give them a solid number and say, look, this is a problem in our community, we need your help. Because I think if you go from the help standpoint and people actually buy in, oh yeah, this is my city.
Yes.
I want to help these people, they're my family, they're the soul of my business. Then it becomes real.
I completely agree. And you're the first city to actually reach out to us and want to do this. So, when we talk about partnerships, this is exactly what we get excited about. And, we'll make the resources available. And I think, your community best. You have personal connections and ties here, and you will support you however we can. But I think this is great.
Okay, good. So I think, anybody else have any other questions or comments? Nicole, Heidi, any questions?
None for
Well,
me.
Hey Heidi, do you think that if we get some traction within distribution for local businesses that we could deploy some of our DEI budget for acquiring more um Narcan to distribute? Like, could we allocate, $500 of our $1,200 or whatever to buying more and then just making sure that, I mean, because I feel like what we're hearing is that the best approach is to just blanket security, and that this is everywhere for anyone who might need it at whatever, you know what I mean? Whether
I
you're
would
at the gas
assume
station or,
so. Yeah, I would assume
okay,
so. I mean, I know that transportation and public safety, they want to do part of their budget for like CPR classes and stuff. So I don't see
okay.
why you wouldn't be able to do that.
All right, I'll double check with Elena has the answers to everything that ever
Mhm.
existed.
Mhm. And so the Narcan that you brought us today, I know that's provided by the county. So if we as a city said, okay, we gave all of our Narcan away, we need more. I mean, are you guys like limiting it to people? Are you saying the cities can only have X amount? Do you guys have a policy?
Sort of. We do have to put kind of some upper limits on what we can give to any one organization. We don't give directly to community residents. We just don't have capacity to do that. It's
Right.
just me and one other staff person. But we do make it available to businesses and organizations who serve people who may be at risk of an overdose. So, you know, different esticated businesses could request on their own if they wanted more than just like one box. They could request directly through us. That would be
Okay.
one way to go.
Okay.
Like if you had a really big organization or business that wanted, several kits, I would just have them request directly through us.
Okay. So on the form that you're giving us, on that sheet, is your contact information on there? So we could just give them that information and then say, if you guys want another box or
Yeah.
two.
So on the business flyer under contact us, there's a substance safety email. It's just a general inbox. Yeah, and that's the
Perfect.
best way to request naloxone. Any questions about trainings or anything else people have? Yeah.
Okay, perfect. Good. So I think we don't have any more questions. Thank you. Thank you so very
for
much.
having me, and thank you so much for being willing to be a partner in this work. It's really encouraging to see cities stepping up like this and tackling some of this work in their own communities. So thank you.
Does naloxone have a shelf life or expiration date?
It does, but it's, I think, 3 or 4 years out. So
Okay.
January of 2027.
Great. Thank you.
Perfect. That's
And what
great.
we can do is if businesses are stocking it or you're stocking it, just keep an eye on that date. And as you get closer, we'll swap it out for you. If we still have funding and supply in January of 2027, we'll gladly just swap that out.
Okay.
It's like fire
Yeah.
extinguishers.
Yeah. Right. Okay, perfect. Thank you so much, April. We appreciate you. And Mads, do we have any public comment online or? No? Do you have anything you wanted?
After you guys are doing that, I'm actually the esticated prevention specialist for Todos Juntos.
Oh, Brad.
Here comes the mic. Just, yeah.
Sorry. It's okay, I don't mind. So I am, can you guys hear me?
Yeah.
Okay, so I'm Tyra Baird. I'm the new Esticated Prevention Specialist with Todos Juntos. So I'll be running the Esticated Prevention Alliance, moving forward with Brian McCrady, there we go. I can't speak English on Monday night. And really looking to bring more prevention efforts into the community and into the schools.
Excellent.
So
Great.
can we consider you to be sort of the contact point for like,
The schools.
yeah, or just correlating all of these efforts? I mean, I think that that's the other thing too, is that the whole blanket effect is really what we need to do and just have as many fingers on the hand as possible. Because we'd like to just bring this more into the conversation. I think that normalizing it as like a community issue is part of what we need to address. So then there's the awareness aspect, there's the action aspect, there's the preparedness aspect, education, all those different things.
Yeah, no, definitely. So we're just starting up partnerships with the schools. I'm actually going to be working with Estacada High School moving forward to do more prevention efforts there. I was actually at the football game on, what was it, Friday last week, doing kind of a Jeopardy game. I was hoping to reach more parents, but apparently Jeopardy is very popular with teenagers. So we had a lot of really good, 20 minutes long of individual conversations as they would answer questions, get them wrong, get them right. We'd have a conversation. And so I'm looking at doing another one on December 17th at a basketball game. So that's part of the partnerships we're working on, and then trying to get into like health classes and different things. But I would love to be able to partner with you guys to help make this happen, because you're right, it needs to be, a blanket thing, but also the best way to lift the taboo of talking about it is to talk about it.
Mhm.
Mhm. Yeah.
Are those instructions, are there any instructions on that box in Spanish?
Not on this box, but we do have Spanish instructions, and we're actually going to be offering a Spanish naloxone training
Oh,
very
good.
soon.
Good.
So I'll get that information as well. And I was going to invite you to join our harm reduction work group, because we love Todos Santos. But maybe that could be sort of like a liaison to the great work happening in Estacada, and then you can let the work group know of any other resources needed. And yeah, we had someone else from Todos Santos there. Yes, Raven. Thank you. Yes, from Malala.
That's great. It's nice to meet you in
Yeah.
person. I emailed you.
Yeah.
That's great. So do any of the committee have should we start just with our comments? You want to start that way or this way?
I have a couple other things. Big vibes. First of all, I have a good friend who is a therapist and I think would be a perfect candidate to add to the DEI. I spoke with her this afternoon about applying and throwing her hat in the ring, and she was really into it. She lives outside of town in Viola, but her address is still Estacada. So I'm going to have her apply because we still have a vacant seat, right?
We have somebody who applied. We do have somebody that applied, but if she wanted to apply, that would be great too.
Yeah, we do still have a vacancy. We did just get an application.
Cool. I love that.
So I believe we're talking about those at the December meeting.
Yes, December meeting, we'll be talking about anybody who's applied, so
Okay.
she would still have time.
Cool. And also I took my kids to the Grange for the first Saturday of the month pancake breakfast, because I can feed them as much food as they can eat for $7. And I
Which Grange?
Springwater, and I renewed my membership fees, and I had a long talk with John, who is the Grange president. He's a retired Multnomah County Sheriff, and he's also the lobbyist for the Grange statewide in Salem. So he's a really good resource. They also do a outreach for veterans that do beekeeping, and then they redistribute all the money that's earned and put it back into veteran services. So I kind of want to bring him into the fold a little bit, or at least use that as an opportunity for us to kind of work with and start talking with the Grange, because it is this kind of network of rural meeting places. So those are my two things that I wanted to mention was John at the Grange and Jen, who will apply.
It's great. Thank you, Mike. Shannon,
I just want to let you know,
microphone.
I've been speaking to Madeline Albright and Megan Dybel. Madeline Albright is the clinic manager
Mhm.
at the clinic, and Megan is the healthcare worker, and they'd be happy to help with our effort.
Good.
Is that at Orchid?
At
Or-
Orchid.
Orchid Health.
Okay, cool. They're so wonderful.
That's good. Good. Okay. Nicole or Heidi, do you have anything to add?
No.
I was watching just the downtown Escada Commission.
I can't hear her.
Yeah, we can understand what
Oh.
she's saying.
I can't understand what you're
sorry.
saying. You're
Hold
all
on,
garbly.
Hold on just a second. I'm sorry.
I'm not sure what she said. I'm sorry, Nicole. Heidi, do you have anything?
I don't. Thank you, guys.
Okay. So I just wanted to let everybody know that there are youth recovery groups happening called So Fresh and So Clean that Ant Farm is doing at their hubs, happening Tuesdays at Sandy, on site. And Wednesday in Malala at their Ant Farm hub, and Tuesdays in Estacada and Tuesdays in Sandy. Peyton is on site from 6:30 to 7:30, and looks like Matt is on site in Malala and Estacada from 6 to 7:30. If anybody's interested and wants more information, they can reach out to Ant Farm, or they can, let's see, could they call Peyton and Matt? Maybe. Since Peyton has her phone number on here, I guess I can give that out. It's 971-413-4839, and Matt is 971-429-2636. So those are great programs for people, our youth that are recovering. And don't think I have anything else to add. So at this time, I'm gonna close our meeting at 6:14. Thank you, everyone.
Thank
Again.
Thanks for coming out.